I think the VSafe system, which was basically didn't exist before the COVID era, was specifically created to help out VAERS or help out for this thing. But,
Right.
In hindsight, it was created to run cover for VAERS because, like my friend Julie Threet in Chico, California, who was helping prepping the jabs. She's not a phlebotomist or a nurse, so she wasn't given the injection. She was just preparing the syringes, in the gymnasium, watching these. She says that she's watching people, fall off their chair, passing out. College students at Chico State, where I went to college. But anyways, the point being was that. They gave the students a card, like, oh, hey, you got any problems, call, here's the go here. It was VSafe. So a lot of people.
I have my flyer. I still have the first flyer. They give you a flyer and it says, I've got a picture of it. They show you, they give you a flyer that if you have any it'll say, oh, maybe just a little fever, a little bit of chills.
Yeah.
Let me see if I can't find that. You guys talk for a minute.
So the point being, Miss Cornelia, is that today, and we only have a snapshot because of Aaron Siri and ICANN and them with the FOIA data, but still, that's a snapshot of when they got that information in 2000, when they finally wrestled it away from the CDC people to get that VSafe data, like 2023. 10,100,000 people are in that VSafe for COVID jabs. And right now we have close to 1.7 in VAERS, and there's only a 40,000 people commingled that are in both systems. But so effectively, 10 million people are in VSafe, and that's altogether a whole different amount of different people than are in VSafe, than are in VAERS.
Wait, Albert, this is a bombshell, what you just said. Did I get this right? You just said that there are 10 million reports in VSafe.
10 million.
10,100,000. And they were all from the COVID shots. Because the VSafe system was created for COVID. It didn't exist before. It's only on a phone. It's not on a website. It's only it's an app, basically. It's an app on a phone, on a smartphone. Mm-hmm. Okay, so there are about 10 million reports in this VSafe system that was created specifically for these new mRNA shots. And then we have 1.7 million reports in VAERS about the mRNA shots. 1.7 versus 10 million in VSafe, and then you said 40,000 are in both systems, VAERS and VSafe. Yes. Or they were transferred. They were rather. So there are 40,000 that overlap. Yeah. However that happened, whether VSafe forwarded them to VAERS or whether they filed another report in VAERS.
It happened both ways, and it's documented in the VSafe system, in that sometimes VSafe people had actual phone calls from the call center from VSafe, and they were getting their check-ins that way through like a human being, and other times they were it's like scheduled in there, like a phone call, especially the people that had however they determined more severe events, because you definitely couldn't check a box like you can in VAERS that you are in you were hospitalized or a life-threatening event. You can check those boxes as a submitter in VAERS, but basically the point is that some people, it was VSafe themselves that were crosswalking, in effect, the VSafe report into VAERS.
So do you know how many of these 10 million reports in VAERS reported adverse events? Because these check-ins just might have been, oh, I feel well, here's my check-in, nothing happened.
Absolutely. There is about 3 million people that participated in the V-Safe, but seemingly had nothing wrong, like good Americans, and there seemingly was no issue or problem because there was, they didn't put anything in there, or they check that they feel good, because that was I feel good today, better, worse, but good was.
You can see my screen, and I've got some V-Safe screenshots to show you what it actually looked like.
Absolutely.
This is what they gave me. I got this flyer on January 7th, 2021, when I took the world's most deadliest and toxic shot, #1, according to Albert. This is what they gave me. And I know that I got this on my first one because it says at the bottom, first vaccination, don't forget to schedule your second vaccination before you leave. And I went home and I downloaded the vsafe.cdc.gov. So I downloaded the app, and so it would text you, and all it asked you is if you have any pain or swelling at the injection site. And then it asked you if you had fever, chills, tiredness, or headache. That was about all it asked you was what was on this flyer.
So if you had a really severe reaction, like a life-threatening reaction, how would you have reported that through VSafe?
So let me show you. So this was at the 42-day. So I took 4 vaccines, but I only took screenshots of these first ones. So this is December 2021. I had just taken a shot in November. And so there's a 42-day and then also a weekly. See, November something I took a shot. So it started again weekly. And right here, November, then it started again daily. You see this? So it messaged you daily for like, what is it, Albert, 10 days or something, and then weekly for like a month, and then at the 18 month, and then it never messaged you. So it said right here, it said, how are you feeling today? And you said good, fair, or poor. And this is when I started getting sick. Look, November 2022. I couldn't report anything because I wasn't really sick in the beginning. And I wasn't sick until November, 2022. I said that was when I got diagnosed for lichen sclerosis, anal fissure, lip shoot ulcer on my clitoral hood, fatigue, weight loss, and more.
And just for the people who are listening to this, we can see here on the screenshot that Melanie was able to put these conditions into an open text field. So they collected that information.
Yes. And at the top, this is a 6-month health check-in. I took my last shot May of 2022. So this was my 6th month, and I was completely wrecked by then.
Okay. So Albert, you said that 3 million people, and we know that, reported in the VSafe system that they were fine throughout the 12 months of checkups. And then it stops, by the way. It's only 12 months, right? And then
12 months. And Ms. Cornelia, just to put a fine point on that, there was 3 million that never reported a negative outcome, like you saw Melanie's like poor, like that. But many people did not complete the 14 check-ins over the course of 1 year. A lot, more than half did not complete the 1 year. But
not surprising.
But I am saying that at least about 3 million of those, the other 7 million did record something, as you know, little bit from a little bit of discomfort of some sort or another, up to you do have a spot in there to check, to actually literally check the box that you needed to seek care from a doctor or a healthcare professional, and that you were hospitalized, I think is like the most. But as far as the diagnosis codes, this free text that Melanie showed you, that was limited to like 256 characters. So
and they never followed up with me. Nobody ever followed up.
Yeah, no,
And
nobody,
they
no,
never
yeah,
texted me back.
nobody will call you and but the point
Yes.
being is the
Yes.
drop down menu of the codes that you can select, the symptom codes. There was only like 12 codes that you could select, and they were like arm pain, fever, stomach ache, a very low level, simple stuff, dizzy. They didn't have on there that you could select chest pain. They didn't have on there, myocarditis or something, if you were diagnosed or something later and you found out, yeah. But basically, like chest pain was a main one that they probably should have had on there. I think they had headache.
Of course.
It was fever, chills, tiredness, headache. I remember. It was just the simple stuff, just like on this flyer. And it said side effects may feel like flu and even affect your ability to do daily activities, but they should go away in a few days. With most COVID vaccines, you'll need 2 shots in order for them to work. Get the second shot, even if you have side effects after the first one, unless a vaccination provider or your doctor tells you not to get a second shot. Nobody was doing that. Nobody was telling you to.
So, Albert, how is this information? How do you know this? Is this how can people access this information from the VSafe data? It seems to be public because you know that 3 million people just reported everything is fine.
The funny thing is it's not public. It is until Aaron Siri and ICANN FOIA'd that information and they got the medical records. But again, they got it and it's only a snapshot of that point in time for, 2 years ago. And Aaron Siri made a dashboard, an ICANN VSafe dashboard. ICANN offered the downloadable files that they received from the CDC for anybody. But that's like 25 gigabytes of Excel spreadsheets that not too many people know how to navigate that. Well, I downloaded it and made my own dashboard, which is light years better than, God bless ICANN, but mine is way better than theirs. But anyways, regardless of that, that's
how many days did it take you to export a report? Remember you told me that it about 16 hours we'll have this.
Yeah, I had my report ready. I had my dashboard ready before Del Bigtree and Aaron went on their Thursday regular show and did the big reveal, because they had the downloadable data for the public on Monday, and I had mine already ready. And I watched the show, and then they're like, look at these 14,000 kids that are 3 years old and under. Oh my God. And they're not even in VAERS. And I'm like, wait a minute. There's 172,000 adolescents in this database. Why didn't you say that? And that very day, I sent an email to whistleblowers at ican.com, and I said, hey, there's 172,000 adolescents. That's way more than 13,000 kids for under 3. Well, in their dashboard, they did not have a filter for relation to the registrant. And if they would have put that filter in, and I told them, hey, please put this filter in your dashboard so that everybody can see that there's 172 adolescents that are dependent. That's where it came out, because the age buckets for VSafe is so disingenuous. There's only 2 age buckets, Miss Cornelia. It's 3 and under and 3 and over. That's it.
What? That's ridiculous. That's unbelievable. This whole thing with VSafe, I don't understand the purpose of it? It doesn't make sense to me, because as Melanie just said, she put in the lichen sclerosis, Lipschitz ulcer. I mean, serious stuff. Nobody ever follows up. They don't call you. Who knows where that stuff goes into some black hole? I mean, maybe you can talk about what actually happened to that data, but nobody will follow up. There is no case number. You cannot, I mean, what's the whole purpose of these check-ins that are just going into nobody knows where, and don't really have any consequences? I mean, one, if you want to think about it, you could say, okay, people might, like Melanie might think, oh, there are people looking at this, and you were probably waiting for a phone call. Were you waiting for a phone call when you did these check-ins and said, oh, I'm not feeling well, I'm getting all these things?
For sure. Yeah.
You were waiting for, okay, so that would have prevented you. Now, let's say you would have been someone who would have known about VAERS. You probably would have said, well, I don't need to file a VAERS report because I already did my check-in, and that's, that's every day, and then it's every week. So that's much.
It said, when I did the one where I just showed you where I had the free form box, and then it said, did you see a doctor, this and that? And then I clicked yes. And then it said, would you like to file a VAERS report? And yeah,
right.
And I clicked it, and it never went.
Okay, so you clicked it. Yes, I would like, please take this information I submit here and file a VAERS report for me. So you thought you had already done that. So there was no reason to do it. So, and they didn't, as you found out later. And I wonder for how many people that is true. And we probably have no clue, right, Albert?
Well, I'm sorry, I lost that last part. No clue about what?
Yeah, so about when I'm in this VSafe system as Melanie, and she clicked this checkbox, do you want a VAERS report to be filed from your information in VSafe? And she said yes. And then no VAERS report.
Dual registrant. Yes. That's what Albert.
Dual registrant. Yeah, right. And then she found out a VAERS report was never filed for her. I'm just wondering in how many cases that happened. Do we know? Do you have any information about that?
No, I do not know, and I don't know that if how officially you get back your VAERS, your supposed VAERS ID when it is filed. I don't know the mechanisms involved in there. I just know that in the VAERS system, when it is, how I determine that it is commingled with VSafe is there's a dedicated field where the manufacturer puts their timestamp. It'll say the word VSafe in there. And I know that nobody can get to that, can alter that field except for internally at the CDC. A submitter can't submit to that, enter any information in that field. So that's how I'm able to determine that there's at least 40,000 people in VAERS that have to say the word VSafe that was entered by somebody at the CDC. So those are commingled with the VSafe people.
Right. So, I mean, if you want to be charitable, you could say, oh, they created this new app because, oh, it's a cool thing to have an app. And then they have these daily check-ins so that people feel well taken care of. After all, it's under an EUA, and people might be hesitant to take it and worried about adverse events. But you could also say, well, this whole thing was pretty useless because nobody ever followed up, and VAERS reports were not created, and we don't know in how many cases that was in fact the case. And in very severe cases like Melanie's, absolutely nothing happened, and we don't really know what they did with this knowledge.
If I would have died, there would have never been any record of me.
And we don't, yes, and plus the data is not publicly available in contrast to VAERS data, so nobody was able to see it until it was FOIA'd by Aaron Siri, and that only gave a snapshot for 2023. So you could say, and you don't even have to be, I mean, it stands to reason that the charitable explanation doesn't get you very far because it doesn't make much sense. it doesn't make much sense to invest into this very, very intense program of how many 14 checkups over 12 months. And in the first week, it's every single day. So that you think, oh my God, they really track me, and they really make sure that I'm okay, which couldn't have been further from the truth, because that data wasn't acted on.
No.
So you could say, well, it was just like some kind of giving you the illusion of being taken care of, while making sure that if something bad happened, as it happened to Melanie, she would not go, or her doctor would not go and file a VAERS report.
Smoke and mirrors like everything else.
Yeah, and safe, and therefore make sure that the VAERS database wouldn't be overwhelmed with adverse effects from the new shots, which, by the way, didn't work. Because can you show that graph, Albert, where you see the VAERS database? It's a graph where you see, it's a histogram. You see the submitted reports from 1990 or so over time, and then how the graph shoots up to like 10, 20, I don't know how many, a multiple of what it used to be before.
I think I was showing, yeah, sure. Let me see here. Let me jump into my entire screen.
I mean, I think they probably did manage to protect VAERS from quite a few additional adverse events reports, like Melanie's, that only came in now. 4.5 years after your first adverse effects, but they didn't manage to hide the tsunami of harm. There we go. That's what I mean. That's the histogram.
Yeah, this is the one they show in in Washington D.C. at all the little Senate meetings all the time. But yeah, this is all the deaths. Supposedly the pro-vax will say that's because so many more people know about VAERS these days, and they're submitting reports and
You mean that people died in 2021 after the rollout of the vaccine versus 2020 during the pandemic?
Exactly. Yeah. I mean, this is shocking.
I mean, this is like supposed.
And this number is underreported. More than 38,000 people died from this vaccine.
But let me take this opportunity to show you my dashboard. And this is my interactive dashboard. This is the whole thing. And I use the latest MedAlerts number to match mine to show that I match. This is 2.6 million reports all the way back to 1990. And there's actually officially there's 49,653 deaths. Let me make that a little bigger. But what I'm saying is that when you actually read the reports, and now that they're giving us follow-up data, which they didn't give us before, not after 2011, but since 2011, CDC decided to only publish the initial report, even though they capture follow-up data. They're not going to update a report with follow-up data. So if you later died a month or 2 or 3 months or 6 months after your report and they find out about it, they'll capture it internally, but they won't go back to the original report and update that you're now doing.
How did they justify that decision?
Well, that's in the that's in their guidelines. They did that January 2011, which was about a month after the Harvard Pilgrim study that was released in late 2010, when we know what the Harvard Pilgrim study is, right? We, only maybe 1% of all the adverse events are actually reported to VAERS for, a myriad of reasons. And as a consolation prize, VAERS decided to only only publish the initial reports, because prior to 2011, they were going back into the initial published report and updating updating the report, adding more to the summary narrative paragraph, and checking additional boxes like, yep, you're dead.
Yeah, well, as they should.
Yeah. So
I mean, that only makes sense. So why would they change that after hearing that there is an enormous underreporting factor in VAERS, like 100, like underreporting factor of 100 or so?
I mean, they don't give an explanation why, but I can show you exactly where they said it. In their guideline is right here. Here it is. So this is from the CDC Wonder System here. I give a link, but right here where they talk about some of the reporting issues that they have, and I highlight right here, they tell us actually 5 times that the initial report is captured in the Wonder System's snapshot for the next data update. However, follow-up reports do not appear in the Wonder System. The VAERS system receives continuous updates, including revisions and new reports for the preceding time periods. Duplicate events and reports are determined to be false are removed from VAERS. That means after publication, like we have 4 to 6 weeks to rigorously vet and authenticate. And if we still didn't find out that it was duplicate and we publish it, we're gonna delete it after publication. So,
well, that's like being Alice in Wonderland,
yeah,
right? With their Wonder System.
So here's one part, the reporting issue. Here's another one where they, in another spot of the guideline, where they say, VAERS public data do not generally change based on the information obtained during the follow-up process. So right here they say do not. It's true. Very rare do they actually go in and update something. Usually they go in and they fix something that they should have fixed for HIPAA. Like somebody says, oh, I was seen at San Jose Hospital and it's published that way. And then they'll go later and get the word San Jose out of there for HIPAA privacy, stuff like that. Rare that they actually upgrade and go, oh, this person's now dead. Technically he was actually dead before they even submitted the report, or he might have died within that 4 to 6 weeks as we were vigorously authenticating. Guy ended up dying after you kind of submitted the initial report. So they do make a little bit of changes, but it's pretty rare.
Look at this, Albert, what it says here. Updated data, which contains data from medical records and corrections reported during follow-up, are used by the government for analysis. So they have that data. However, for numerous reasons, including data consistency, what kind of nonsense is that? These amended data are not available to the public. So they are hiding. In other words, they are hiding the data and they are justifying it by saying, oh, we are keeping our data consistent, pretending that the data didn't change. It doesn't make any sense. They must have been thinking, what kind of reason can we give? Can we give to the public that we don't show the data? Oh, data consistency sounds good. Let's use that as a reason. And maybe people won't think about it. But this is absolutely outrageous. So they have the data, and the data must be showing that like chest pain developed into myocarditis and maybe something else developed into somebody dying. Lots of cases like that, and they hide it.
Question. Am I understanding that right? If Melanie said, okay, how about this? If VSafe would have made a VAERS report for me, and then nobody ever contacted me and told me that there was a report or gave me that final ID, and then I decide after speaking to a guy named Albert, oh, well, I'm going to make a VAERS report then. And then I make a VAERS report and they detect that as a duplicate. Which one do they delete? The one from VSafe, the new one that I made, or both?
Technically, it would be the ones that I've seen that they do delete. The one they receive first would be they would keep that one. So in officially, if your report was in there, they should have detected it. and then not publish the one that we submitted officially. Just not, they wouldn't have told that. I highly doubt that they would have came back and said, "Oh, Melanie, sorry, we detected a previous report at ID such and such. Therefore, we're not publishing this one that you submitted."
So all my new data would have never been updated.
Yeah, never updated.
You know, I'm going to have some new diagnoses. I just had a brain MRI. I've got a new diagnosis coming. I have a cyst in my sinus thing. And then do you think, and I've got a couple more things coming up, tinnitus, I'm seeing a hearing clinic, and then I'm having a cognitive report. Do you think after we get a couple more things, should we go try to update my VSafe report and just see and just prove that they don't update?
I'd love to because I should have done that with my own uncle just to because I want to be a student of the follow-up process. But the point here, like bullet number 4, you see where they tell us only the initial report, even though they may have also have several subsequent or follow-up reports. But here it is, Miss Cornelia. This is what I'm. Since January 2011, only primary reports are included in the data. So replace that data with saying only published, because they have internal data, because they keep telling us they continue to capture follow-up data. That's
exactly.
So when was that Harvard Pilgrim study published? That was like in September or October of 2010. So there it is right here. When you put it together, when I go into the data, all the VAERS stuff pre 2011, I can see exactly where they've updated reports. And thank God for Stephen Rubin, the creator of MedAlerts, who at this time was capturing the follow-up data, all the different edits, additions and deletions that they were doing. That's the proof right there, Miss Cornelia. The Harvard Pilgrim study did not have to contend with this new paradigm shift that we do now, where we have to ask ourselves, well, gee, how many people are now since dead, but they were alive on the initial submission?
So it sounds to me like this Harvard Pilgrim study threw some light on how much greater the harm is that is done by vaccines, and way, way greater than the data that is in VAERS. And publishing only the initial report and not updating reports would make it possible to bring that number down, to obfuscate, to hide bad data, and to make it appear as if vaccines are safer than they actually are. So that could be the reason. Another question is, how many people work for VAERS? How many people, because this system is awful. It's an absolutely horrible system, but it creates a ton of work. It's so nonsensical and so convoluted, and it creates all these duplicates that shouldn't be the case. You should have a system that makes it impossible to create all these duplicates, and they have a system that invites duplicates, and we'll go into that later. I mean, it must just be swarming with duplicates because they have so few mandatory fields. Not even your name is a mandatory field. So often you don't even know which reports are duplicate. You can't know because the hospital, the doctor, all these fields are non-mandatory. So you can submit these reports with very little data. And then there's no way of knowing what is duplicate. But they're doing that on purpose. It's very easy to make a field mandatory, and they are not mandatory. So you end up with a system with data that is really crappy, that is really highly, well, it's really unknowable what you have there, what you're dealing with. And that probably also serves for obfuscating it, because making these changes is very, very easy, and everybody would say, yeah, of course, these fields have to be mandatory. Otherwise, how can you even make sense of your own data? But they didn't do that. So, but yeah, coming back to how many people work, how many employees are there doing this verification?
That's a good question. The actual VAERS people and how many adjudicators, I do not know for sure, but I do know through the Epoch Times FOIA document that journalist Zachary Steibert, who works for Epoch Times, and he had that FOIA for the CDC again for General Dynamics, who was brought on to help with staff, and they got 200 people, and it came out to be like $46 million contract to General Dynamics. So they came in like the Navy SEALs right in the beginning of 2021. And in that communication, I at least know that many that they brought on 200 people at VAERS, which I think should be sufficient to do all this, on top of however many people they officially had that were non-General Dynamics people.
So they contracted with General Dynamics in what do you say, 2021, bring in 200 additional people because the system was being overwhelmed by all these.
They were anticipating,
reports.
I think they were anticipating or something, but by February of 2021, they were there. General Dynamics was on the scene.
Oh, no kidding. In February 2021, that early. Yeah. And do you have any idea of the people who work at the CDC and FDA in the VAERS, I don't know, group or whatever they call themselves as government employees? How many are those?
Actually, I do have I actually have a dashboard of that. There was HHS is 80,000 people. And then it breaks down to CMS, which would be like Medicare and Medicaid, but it's not really CDC, CMS and Medicaid. CDC, I'd have to look at that. That's something that Grok would know, Twitter Grok, how many employees at the CDC. But then from there, how many people are actively entrusted to just manage the VSafe system. I don't think that many are actually needed. But Cornelia, that's a real good question. I just want to throw out there that working at BioReference Lab, we were processing and sending out 18,000 to 22,000 insurances a day for 7 days a week. And we had a billing group. The staff was 200 people in New Jersey.
Okay. So we don't really know how many people work, how many government employees in the CDC and the FDA work on VAERS. But it would be interesting to know, because to put that number of 200 additional people working on VAERS in perspective, and that happened in February 2021, very early on. I mean, does it mean that they doubled the number of people working on VAERS, or maybe they quadrupled it? I don't know. Maybe they had just 50 people working on it, and then they hire 200 more. So because that gives you an idea of what they expected would happen, and that would be interesting to know. I would like to actually, because I went into VAERS and to pretend to submit a report because I wanted to see these forms. And I would like to just briefly share my screen to show you what I found, because it's so shocking. Okay, here we go. So this is VAERS Home. Oh, this is interesting here. This website is being modified to comply with President Trump's executive orders. We should talk about that as well, Albert. Okay, so as I scroll down, there are two ways now. I think this is the option 2 is a new option. 2 ways to submit an online report to VAERS. You can do it online, and then you can also use a writable PDF form that you download, and then you fill it out, and then you upload it. I had to look at it. It looks absolutely awful. It looks like a tax form, like a really complicated tax form. when you do your tax returns. It's like doing your tax returns.
When I was initially trying to figure out how I was going to file, I downloaded that printable one, and it was so confusing because I didn't know which VAERS, which vaccine dose to attribute to what affliction. And then it would ask for the doctor, but it only gave you fields to submit for one VAERS, one shot, one lot, one vaccine lot. And it was overwhelming for me. I had cancer and I was too sick, so I never went back to it. But
well, if you are sick, even if you feel just a little bit sick, you will not be able to deal with this writable PDF form. It is horrible.
Yeah.
So then I looked at Report Online, and here it looks much nicer, but you have only isn't that nice here? Look at that.
20 minutes.
Your information will be erased if you are inactive for 20 minutes, or you will receive a warning after 15 minutes. So if you work on it for more than 20 minutes, you're being kicked out of the session and you have to start all over. They don't even save it, which is not, I mean, you can say, oh yeah, these people are incompetent. No, that doesn't fly, because that is just such a basic requirement that you cannot say people are incompetent. That doesn't make any sense. I mean, they make it as difficult as possible to submit these reports. So let's click on this and go in there. And now you can see here, so it's like a survey form. And you see that the fields marked with an asterisk are essential and not should be completed, must be completed. Those are mandatory fields. But now look at this. Patient first name, patient last name. It's not a mandatory field. You can leave that out. Where you live, okay, well, maybe that shouldn't be a mandatory field. Your date of birth, that is mandatory. Your sex is mandatory. Date of vaccination is mandatory. Date adverse event started is also mandatory. And your age at vaccination is also mandatory. Okay, then there's all sorts of stuff that is not mandatory. Pregnant at time of vaccination, not mandatory. That should be mandatory. Prescriptions, okay. Allergies, all this. You can say we don't want to make too many fields mandatory, because then people will not fill it out. It will take too much time. So there's always, you always have to strike a balance. But let's go to the next page, and they let you continue.
No, they didn't.
Well, when I did it this morning, they let me continue it. They don't let me continue it now. Isn't that interesting? Wow, that's annoying. Why don't they let me continue it now? No, I want to continue to the next page. Come on. Okay, now they let me do it. All right. So, form completed by. Now, this is not mandatory. I think this should absolutely be mandatory. If it's the physician or whoever completes the form, you want to know that name. You want to know the relationship to the patient. Is it healthcare professional? Is it a parent? You want to know who that person is. That should be mandatory.
Right.
Also, I think
field might help with the fraud.
Absolutely. Absolutely. I mean, for verification purposes, if you leave all that empty, you cannot verify. Street address, I think that should also be filled in, so that you know if somebody, if your name is Dojo, that and you have 10,000 others of the same name, you can distinguish them. Your email address, yes, of course. Email address should be a mandatory field. Otherwise, you cannot contact the people. It's not a mandatory field. And then look at this. Best doctor, healthcare professional to contact about the adverse event. Not a mandatory field. I mean, that's just speechless. Yeah, not a mandatory field.
Well, and whether or not it's mandatory or not, I had 5 different doctors, and I'm trying to report 4 different vaccine doses. So it's very confusing, because
yes,
you know what I mean?
And then look at this here, facility and clinic name, not a mandatory field. Street address, of course, that's also not a mandatory field. And even this type of facility, not a mandatory field. Let's go on. Here, enter all vaccines given. That is a mandatory field. Describe the adverse events. That's also a mandatory field. Okay. Result, mandatory field.
Those are, yeah. I mean, they have the little red asterisk, but they're highly encouraged, but they're not mandatory. Just like you're skipping through all of these, it's letting you go to the next screen.
Well, I left all the mandatory, or all these that I thought were mandatory fields. I left them all empty, and then I wasn't able to submit. It gave me all sorts of error messages that I needed to complete certain fields.
Wow, you actually hit the submit button?
Yes, I did. I wanted to see what happened, and it told me, no, they fill in this, fill in that. So at least some of these fields that should be completed are mandatory. Wow. But now that you say that, I don't know which ones are. I assume that all of them, because usually with an asterisk, it's a mandatory field. So result, outcome, adverse event, that is mandatory. Let's go further. Now look at this. They don't want to know which vaccine. They don't want to know.
Oh, you pull that, you pull it down, you click on it and choose, that's the vax type, and then
I know, but it's not a mandatory field.
Oh.
Now this is crucial information, right? Of course it should be a mandatory field. Patient's race, I don't like that. For all sorts of things you have to indicate your race, but in this particular case it's actually interesting. It's interesting to know if, let's say, someone who is Black, someone who is white, someone who is American Indian, whether there are any differences in reaction, or maybe some people, because of their ethnicity, because they are medical, there are definitely medical differences between races and even ethnicities. You want to know if some people are particularly prone, maybe to myocarditis or some other disease or adverse effect. So in this case, it would actually be interesting to know what the race is.
It's not published. They have it internally because it's there. You see it, but it's not published in the official VAERS report.
Also military, that would also be interesting to know who is because these are usually probably healthy, strong, younger people. How do their reactions compare to others? And then there's the submit button. So if I click on that now,
you didn't put in did you type in the word verification? Yeah, you type in 1D7.
No, I didn't. Oh, let's try that. I didn't do that.
I do have to tell you, submitting a fake or false report is a felony.
Oh, you're right. I saw that. Okay, so I shouldn't do. Too bad. I would really like to test that. But it says warning.
Yeah, that's why I was saying, wow, you hit the submit button. I didn't even do that. Yeah, I wanted to.
Oh, really? Well, it didn't even occur to me. It didn't even occur to me, Albert. But you're right. No, but see, it wasn't knowingly then. But I would have to prove that. Knowingly filing a false VAERS report with the intent to mislead. Well, that certainly wasn't the case. But yeah, then I won't try it. So maybe it was just because I didn't click I have read and understand, and I didn't put in the caption here. That's possible. But you can see here that the whole thing is ridiculous. It's very, very likely that a lot of these VAERS reports are unidentifiable, and you cannot even tell what the duplicates are. You don't even have to give your name. You don't have to give your doctor's name. The doctor doesn't have to give his name. The doctor doesn't have to give the clinic's name. It's just rubbish. That's not a serious vaccine adverse event reporting system at all. It's like a bad joke.
Yeah. Well, to VAERS defense, the submissions defense, the way Melanie and I did it, we were on Zoom. I had the controls. Melanie was watching. We had created a Word document ready to cut and paste because we were on the clock, but I had the controls. So I said that I was the submitter and I'm a friend and family, but when I put in what was my telephone number, I put in Melanie's number. What was my email? I put in Melanie's email so that she would get all the correspondence and all of that. I was just the blind eye, seeing eye dog or something, just filling out the report. But for all intents and purposes, it was Melanie. But when you think about this, they like all the different. They even asked me for my address. Like, oh, what's your address? I gave them my address. I think I even gave them my official telephone number, but for Melanie's information, I gave them all of hers. And they asked the address of the vaccine site location. And then they asked for the address of the hospital and the attending physician. So, yes, the normal person would probably struggle a little bit because of the time. They put an arbitrary 20 minutes, but there's no reason why they can't change that arbitrary time to make it 30 minutes or 45, and then maybe even allow you to save it. Okay, but I get it. It's arbitrary. But the amount of information, and just to know that 85, regardless, 85% are submitted by healthcare professionals. So slightly more wherewithal in submitting. But they do have all that information. And then once it's submitted, I would imagine their software internally can capture the low hanging fruit to say, oh, this is a duplicate. Can you confirm, adjudicator, that this is a duplicate, based on all this information that we got? And then possibly, the requesting for additional information in the 4 to 6 weeks of rigorous authentication and vetting, which I question if it's actually going on, but at least on paper, it sounds good. With that, Miss Cornelia, there is 30% of the 1.6 million COVID jabs, 30% of the reports, 550,000 reports, that have an unknown age. And you saw the options for the age. You could put your date of birth, your full date of birth, or you could put the month and year. I don't remember if you could just put the year. I'm 50 years old. If you could just do that without any date of birth, without any, November, 72 or something.
That's why they can't update anything, because they have a first and last name, no middle initial. And if without a birth date, how are you going to find John Doe of 5,000 John Does? How can they keep this organized?
Well, on the initial report, if the second report, like if you want to follow up with yours, Melanie, like I want to submit voluntarily. Nobody asked me. I didn't get pinged, because you are going to get pinged at 90 days, or at least at 90 days, you're going to get pinged for like a follow up, and you can do it then. But say you want to go ahead, get ahead of them and go, I got my results back. I want to do it myself. There's a mechanism to go in there, and you get a key. You're going to get a key. You go in there, and part of it is with your temporary ID number. You're going to say, I'm Melanie, such and such. And
right here, a one-time use case-sensitive key sent via email is required in order to access the tool.
There you go.
Individuals assisting us in our follow-up efforts may also receive a key by VAERS staff. The tool uses the key as well as the patient's name and date of birth to authenticate a session. You may upload up to 3 documents per session. Contact VAERS to request additional keys. Want me to share this screen real quick? You want to see this? So here, right here in the upper right corner, submit follow-up information. So you come to the VAERS website, you submit follow-up information. A one-time use case-sensitive key is sent via email in order to access this tool. So I go to the VAERS auto upload tool, and then I don't have a session key, and then I have to put my email, and then I have to enter my VAERS ID, which is in this right here, and put that, and then my name, and then VA. All right, request a key. Let's just do this lot. A session key has been created and sent to the email. Check your email. It's only valid for 30 minutes. Okay, let's go check my email. Oh, there it is. Document request. Okay, so they didn't send me my key. I have to click unlock message, and then now I have to verify my identity again. So they're going to send it to a web wizard at iCloud. See this? Now I have to go back here. Now I have to verify my identity.
Twice
So now
again.
we have, yep, now we have to get another one.
That is bizarre.
Yep.
I mean, they just did that.
Yep.
So now they're doing it
Wow.
one more time.
Now downloading message. Here it comes. One new message, still downloading. They're getting all my information. They're getting my IP address. They're getting my physical location. They're pinging me. They're probably adding me to a map right now. Still downloading. Still downloading. Get mail. See if you look down here, downloading one new message.
Man,
Yep.
just to give you the long key.
Yep. Get mail.
Well,
I don't want you to update your report, Melanie.
211. Okay. Yep. That's still the same one. Get mail.
Well, the good thing is, Miss Cornelia, is that these last two updates for VAERS, they have retroactively now dumped in the follow-up data for all these VAERS reports that they've had internally. They're slowly giving it to us, and that has to do with that original message, probably, a win for Bobby Kennedy, and that this is the biggest change in VAERS since 2011. That's why I bring up 2011 when they were appending initial reports of follow-up data. They're basically doing that again and retroactively, except it's a little bit different setup in the sense that you have to dive in, do a couple more clicks to see the follow-up data. The follow-up data doesn't affect the initial reports data, the summary data that all the simpletons are going to get. And in these 2 months worth of follow-up data, all the way back to 1990, they've touched about 150,000 reports so far of the 2.6 million. So a little bit of COVID, a little bit of all the non-COVID vax types, and all the way back to 1990. It's speckled in there. 150,000 reports. You know how many people are now dead that we could see that aren't dead on their initial report? 1,000.
How many?
Wow.
And they just started to do, they only touched the first 150,000 reports of the 2.6. Of the 1,000, about 800 of them are COVID jab. They're COVID people that were alive and will remain alive. If you go in, it's not going to affect the summary stats or the red boxes, or even when you go into the CDC, they don't have a separate, at the CDC Wonder site, they don't have a separate summary view for follow-up data. Now show me everything with the follow-up data. Like how many people are now since dead?
It's a real wonder site. You can only wonder about it. I mean, they don't even show you that on the site. So they announced that when last month?
Not last month, the month before that. So we got June, May, in
April,
in May.
Okay.
Yeah.
And do they go from today backwards all the way back to 2011? So they started working their way backwards.
There's seemingly no order. There's no order because they're giving us some follow-up data for COVID people from 2021, and they're giving us data from people from 1990.
That is weird. From 1990, but why from 1990? Because they kept updating until 2011, I thought.
No. So VAERS.
I got it. It's in my junk. Look at.
Oh, okay.
Look at. It's in my junk inbox over here.
And now you have to
So
verify.
I gotta verify me. Okay.
You got the key. It's just going to give you a key.
This is just to get the key to access my VAERS report. All right, here we go. VAERS electronic document request. Thank you for contacting VAERS program. We've received a report of possible adverse reactions following a patient's vaccination. You are welcome to use the VAERS auto upload online tool to submit additional information. In order to maintain confidentiality, a one-time key has been created. Upload patient information using the link below. Thank you again for your collaboration. Add or drop files here.
Yep. So
or upload here.
So 2 ways, right?
Yeah. Here's my session key. So let's copy that, and now let's hit this link. Okay, so there is our key is in there now. So now I have a session key. So now we got to go back and add my name.
I wonder how many people would have given up by now.
Yeah.
Yep.
Or said, oh, well, I'll do it tonight. I do it on the weekend, and then they'll end up never doing it.
Yep.
Or the key is only valid for 30 minutes and they send the email at minute 35. A37C8. All right, here we go. Let's access my report. All right, submit follow-up files. I should submit my Social Security disability letter. But
so now you can actually submit from
now
here, right?
I can add some
stuff. That was quite an odyssey to reach this point. That took us, I don't know, like 10 minutes.
Yeah.
So, but back to what you said, why do they publish updates for 1990? Because until 2011, they did publish the updates.
Original submissions, the whole VAERS system started in 1990. So VAERS came into creation and began receiving reports starting in 1990. And then from that point forward, follow-ups to those reports in 1990 started to come in, within a month or two, or almost immediately, I would imagine. And in those days, only from 1990 to 2003, now this is just, med alerts didn't exist. The only way to go see VAERS was to go to the actual CDC Wonder website. And that's in 2003, this is when Steve Rubin came along with Barbara Lowe Fisher, and they created medalerts.org. And now you had two ways to do it.
Just say quickly what medalerts.org is.
Medalerts.org is another website that has a lot simpler functionality to query and read the VAERS reports, but it's not an official CDC website or an official governmental website. It's just a private citizen like myself who goes to the CDC website and downloads the raw data and then presents it. But I will say that they don't change a word, a period. They don't add nothing. What you see is what you get. And I will authenticate that it is 100% exactly what the CDC has.
Yes, and it's more user-friendly. It has a better user interface so that it's easier to query the data.
Yeah. Which is like mine, which is like my website, except where I deviate is that when I told you that 30% of all the COVID jabs have no age, well, many times the age is properly documented in the summary narrative. I will go in, find the age, and then populate the age field in my website that's not on the official one. So as an example, I beat down that 30% down to 8%. So I found like 365,000 reports that have the age properly documented, and I plug it in. I'll fix the typos and the lots. I'll do all the ethical cleansing, I call it. And then I have a method to toggle back and forth between WYSIWYG, what you see is what you get, and this is the real stuff after it's been ethically cleansed. So I will find, for instance, an extra 25 Moderna deaths that are that you don't see, that nobody sees because they're classified as unknown vax type.
what you did is amazing. You found all sorts of hidden things, or that the VAERS system doesn't want us to see, but you figured them out. And tell us how you did that and what exactly you found. We won't have time for that now, but I want to come back to this thing with updating the data, because I still don't understand why they would publish any data from 1990 with updates when they changed the system in 2011 and said from 2011 onwards, we only give you the initial report.
Yeah. Well, Bobby knows that full well, that they were only publishing initial reports from 2011 forward. And he probably had the same question as well. Like, I wonder how many people are now since dead.
Yes.
So I think that's one of the things where, it's monumental. It's never happened before. I mean,
okay, now I get it. So the people, let's say somebody in 1990 filed a report, or maybe somebody in 2000 and let's say 2009, I think that's more realistic, filed a report, and then shortly afterwards, 2 years after, they changed the system. So if this person had an update, did an update in 2012, just a couple of years after the event, then that update would not be
retroactively giving us all the old stuff that they've been holding on to that they've never published.
Okay, so going all the way back to 1990, got it. I didn't understand that. Yeah, that makes sense. But that it isn't done in, they should, of course, the most interesting data, all the data is important, of course, but the most interesting data is the one from today back to 2021.
Yeah, for sure. That would be a great start. They should have done that first.
Yes. Okay. But, well, good, great change, and a really seminal change in the VAERS database, it seems. You said since 2011, that's the most significant and positive, well, actually a positive change compared to 2011, correct? Okay. So I think we call it a day for today, but and we'll do a second part because there is so much more to discuss. And just to go over, let me see what we should discuss. I want you, Alba, to show us your amazing website that you built, VAERSaware.com, your dashboards, the information people can find in the dashboards, the all the data that you discovered, in addition, way beyond what VAERS gives out, or what can be discovered in this Wonder database from the CDC that is used to dig into the VAERS data, and how you're doing that. Also, I want you to talk about how VAERS hides data and obfuscates data. We got into this a little bit, but I think there is a lot more.
There's a ton more.
There's a ton more, right? Also talk a little bit about open VAERS and Met Alerts, the system. These are also systems, as you said, developed by private citizens that are very helpful. I'd also like to find out how the VAERS website says what is being modified due to Trump's executive orders. What is changing? What has been changing, probably because of RFK's influence, how you see all that developing. And then I would like to hear how you, maybe a little bit more about Melanie's case, because her case is so complex and so horrific. Maybe helping people to giving some tips how to submit a VAERS report, and how you would improve VAERS. If you know so much about it, how would you just give us some ideas how to easily and cheaply, and quickly make real improvements in VAERS?
Absolutely.
And that should be anything else?
No, just that Melanie is going to be the capstone on the world's greatest VAERS analysis report that I've been building for this whole time for 4 years. And it's an analysis that is simply temporary ID versus final ID variance. So I have about 85 people like Melanie and chain of custody that I can reach back and contact all of these people, but I've kept track of their temporary ID and their real ID, their final ID, and you can see the graph, the variance, the distance, to basically corroborate what Bobby said, that not all the reports that they receive are being published, and I can feel like I can calculate that in just the number that Melanie was given like a temp ID in the millions, but she got a final ID in the 2.8 millions. So there's not that many, excluding all the people that don't participate, like all the foreign reports, all the reports that are bulk submitted by the manufacturers domestically. When you factor all that stuff in there and you realize, wait a minute, there really should be a lot more people published in this VAERS system, unless that every third report we're receiving happens to be a duplicate, which is complete bullshit. It's, it just can't be. But this is what my analysis is about. And Melanie, I say, is the capstone, because she's the last person. She's like the 85th, 86th person, because I needed somebody recent to submit a report, and I didn't want to create a felony by faking a report of a bee sting. I just needed the temp ID and the final ID. So when Melanie came in, I got her like a hidden spider, like one of them trap spiders. I'm like, oh my God. Plus she also had coincidentally took the most toxic lot in the VAERS universe, Moderna lot number 032H20A. The most toxic lot. So we can talk all about that next time.
Yeah, I'd like to learn more about that. I look at your Substack and I'm trying to kind of decipher, and I don't know what's significant and what's not. I'd like to learn more about my hot lot. I also am number 28 on the hot lot list.
Oh yeah, you got another. You got another doozy.
Yeah.
I don't know how you made it.
Trying to stay alive.
Yes. Let's talk about that as well. That Melanie, the capstone, and what you discovered, and amazing. I also want to hear more about how you managed to do that. That is tremendous, Albert. By the way, how much time do you spend on this a week?
All day, every day. I'm going to go back as soon as we're done. I'm going to jump back on and do it. All day.
I'd like to see some of your memes, some of the stuff that you've screen grabbed, like these holy shit moments. I want to look at some of that.
Yeah, those are those are there. Everybody can go there. I got a PowerPoint. Just poke around in the more section.
Yeah.
I'll put the link to your PowerPoint and to your database below the video. Albert, excellent. Do you not work as a medical biller anymore?
No, I haven't. I just do little side hustles. My Substack is, eked out a meager, modest living.
Maha needs to hire him, Cornelia.
But yeah, I've been posting on fumes for this whole time. This is not, but at the same time, I'm a lot more less stressed and at peace, but I'm as broke as a joke. But
he has a donate button at the top of his.
I was way more. Yeah, I was way more stressed out when I had to manage a big billing department, and I had doctors screaming at me. I had CEOs screaming at me. I had insurance companies that didn't want to pay me. I had patients, everybody was screaming at me. It's like, what? It was so stressful.
I bet. But the work you have been doing, the time you're investing, the findings, the knowledge we have gained from you, it's a tremendous service to.
Oh yeah. That's people. Cornelia, that's why I'm at peace. When I used to have a real job, I used to call myself the caged eagle. I'm like, set the eagle free, man.
Free the eagle.
I always had a stiletto on my neck trying to steal my trophy and jump on stage with it.
So now you're soaring. You're free.
Yeah.
Good.
I'll make another
Good.
donation
No,
to you.
no, don't
First one failed.
worry.
I'll
Hey, the
this
universe will provide. Don't you guys worry.
Thank you so much to both of you, and I'm looking forward to the second part.
Thank you, Cornelia. We'll
Thank
see you again
you.
soon. Bye, Albert.